Welcome back to Ask the Educator, a podcast for all professionals involved in medical device processing and sponsored by Healthmark Industries. The education team here at Healthmark has 280 years of combined experience in areas ranging from sterile processing, endoscopy, OR, biomed, to hospital and industry leadership. Our goal is to leverage our collective experience to answer one of your questions each episode, giving you the practical tips you need to succeed in the evolving world of device processing. My name is Kevin Anderson, clinical educator here at Healthmark, and I will be your host. Let's get started. Hello, everyone, and welcome back to the show. For this episode, it is my pleasure to introduce to you Tony Monaco, president at MK Medical Consultants. Tony is an environmental scientist with 31 years of experience as a public health official with the New Jersey Department of Health and Senior Services. Tony, I just want to welcome you to the show and thank you so much for joining me. I really appreciate it.
Thank you, Kevin.
So, Tony, I just happened to be browsing on LinkedIn and looking through your profile, and I couldn't help but notice that you had received an award from Isham. I don't know how long ago, but I'd love to hear about that because I think it is probably on point with our topic that we want to discuss.
Yes, it was recognition for being the first state in the country to mandate certification for both central service technicians and managers.
How long ago was that?
The bill actually passed in 2003.
2003. And so they addressed it with managers and techs. That's something I didn't realize. So they made that as a distinction specifically, right?
Yep.
Excellent. So the reason I thought it would be important to bring that up is because recently there was news of Pennsylvania signing into law a requirement for certification for all new techs. And I thought since maybe you are the first state and heavily involved in that, I would love to bring you on the show and just see what your general thoughts are on that. I know that they are only the fifth state now. Yours was the first in 2003. They are only the fifth state now to require certification of SPD techs. And obviously, we're all advocating for that, but it seems to be moving at a pretty slow pace, wouldn't you say?
Very much so. I expected it to move much further at this point. I don't know a great deal about the Pennsylvania bill, only what I've read in news releases, and it looks like they're requiring new technicians that are coming into the field to be certified. In New Jersey, we required all techs to be certified, and we gave them a 2-year window to get certified. In Pennsylvania, it's a different situation, and they probably know their abilities because Pennsylvania is different than New Jersey in that you have a large geography. You know, you have major cities, you have a lot of rural communities, and you have everything in between. The question is, do they have enough of instructors statewide to support the needs if they had all central service technicians to be certified? I don't think they do. So this is probably a good first start approach to it. It could cause some animosity among central techs once it rolls out, okay? But you have to look at it as an opportunity. You have to look at it as they have the ability now to build infrastructure within Pennsylvania so that they have enough of instructors statewide to handle any future demands. So that's important because, you know, the national associations don't do enough to train, to certify, and to maintain a level of instructors out there. That needs to improve. So the burden falls on the local state chapters to build that infrastructure to meet the expected demand. So getting new hires through the program first is a good first step. All right. And then once the infrastructure is built, now central managers can bring, because there will be a liability issue here. You'll have half your staff certified and half not certified. So it provides the central service manager a good argument within their organization to require all techs to be certified. And this way you can ease into it slowly but surely.
Yeah, I think you brought up two really good points there about the education infrastructure. I thought something that was really interesting when I made my crossover, if you will, from operating room into the SPD world my manager at the time, who was the director of surgical services, found an online program that was designed to help us as students get through the ISHM certification program, which I thought was interesting, but it was offered through Purdue University. So there are some, courses out there within colleges, even though they're, quote unquote, just certificate programs. They're not like full-fledged associate degrees or anything like that. I've also seen people out there advertising their own classes and education around getting certified, which I think is great. But that's a great point to, be cognizant of is, do we have the infrastructure to support the mass requirement for certification? The hope is yes. Hopefully we do have that, but that's a very important distinction between New Jersey and 2003 and today, I think, is grandfathering in all of those folks who are already in the industry and not requiring certification. Obviously, you hope for everybody, but, we have to look at it as a step forward, right? And that's the big takeaway.
I think another important issue with Pennsylvania would be the implementation of it. What I would suggest Pennsylvania doing is actually requiring that new staff get a job first and spend 6 months in the facility prior to sitting for the certification exams. So this gives them the time to build their skill sets, the how-tos of the jobs, and also get an appreciation for the job. Do they like this job? Are they going to stick with it? Are they going to make a career move out of it before they go for certification? I think that would be a wise move. If you required certification before they get a job, they're going to have an impossible time getting the number of required hours that these certification programs require, because none of the hospitals or ambulatory surgery centers will want to bring on someone that doesn't have liability insurance, that has no immunization record that's required by state standards. So I think a wise move and a less costly move is to let these new candidates get a job, work, see if they like the profession, and if so, sit for the exam.
Yeah, and that's a great point as well, because, in facilities, even in my area where the state doesn't require certification, there are hospitals and health systems out there that have built in some infrastructure around central processing staff, and they've actually built in ways basically to make a tier level so that you have assistant techs and then you have the full-fledged tech that are certified and so on, and you might even have an educator or even a manager tech on top of that, or supervisor tech on top of that, based on their experience and professional background. But I think that assistant level role would be a great one for people to get their feet wet, get an understanding, maybe do some of the tasks in the department that don't have so much weight on patient safety, but at the same time, they can see what's going on in the department and get that experience that you're speaking of.
Absolutely.
Yeah. So I'm wondering, we had talked prior to this recording, and we had talked about also there's opportunities and challenges moving forward. Some of those may be, looking at how is this going to impact the ASC versus the acute care facilities. And obviously you had talked about it in the beginning with New Jersey, but the management as well, and requirement for certification for them, or just having credentials for them in general.
I think the manager piece is a very, very important piece. Right now, presently, both associations have books, management books. ISHM, during their national convention every year, has sessions that are specifically dedicated to management. However, I find all of this too little too late. And I think, as you suggested earlier, I think it's time that we really need to build management program across this country, whether it be a virtual program out of a university, a 2-year associate's degree. I think formal training in this area is paramount, because if you have a weak central service manager, you're going to have a weak program, regardless if you have certified techs or not, because there's so many different moving parts in a central service. So management is key.
I agree with you, Tony. And management, if you have a high quality manager, can make up for some of that, variation, I guess, in the skills and training of the staff by properly managing the department. There's just a variance, a wide variance across the entire industry of who's recording what, who's measuring what KPIs matter, and how are you doing it, and how are you managing quality in your department is so widely variable across the industry. And educating those managers, I think, is a prime opportunity to elevate the entire industry and to get some standardization involved in terms of quality management. I think that's a big part of it. And I think business management, coming from, a former nurse's background and moving into the management role, I can safely say that, we get promoted many times based on the fact that we're pretty darn good at the job we're doing, but the management role is completely different. And oftentimes you move into it and you find out how far in over your head you really are. And it takes a lot of work to even tread water at that point. But, it's a very good point to bring up and to address going forward, I think.
No, I agree with you totally. As I said before, like the certification requirement was from 2003, correct? From that time until today, nobody's never took the opportunity to really evaluate the effectiveness of this program. No central manager, no association, no one has looked at it to see what's going right, what's going wrong, where do we need to make changes, what is the total impact on it. It's clueless.
Yeah, that is another really big point, because I know nursing is another great parallel here, because I graduated nursing school as an associate's degree nurse. And as soon as I got my first job, I was already hearing about how, you got to get a bachelor's degree. They're only going to want bachelor's prepared nurses. And, that bugged me a little bit, honestly. But unfortunately, or fortunately, however you want to look at it, there seems to be quite a bit of literature out there now that does support that the more percentage or higher percentage of bachelor's prepared nurses you have in your facility, the higher level of quality of care. And I would think that the same would hold true in Central Sterile. But unfortunately, to your point, it sounds like we may have missed an opportunity to draw those conclusions and draw those parallels through the form of actual study and things like that, publishings. And
the opportunity still exists. Just people have to go out and do it. You have to motivate people to want to give back to their industry. Anyone that's in a management role right now and is working on a degree, this would be an excellent research project for them.
Oh my gosh. You are right. Yeah, absolutely. It's a great research project, and especially for those facilities that maybe they have an entire health system where it's several different hospitals, and you have maybe a director of sterile processing that could do something like that. And they could actually take quality data from every single facility and tech and figure out on an individual level, how does that level of education impact the quality?
Sure.
Yeah.
I'd like to see it done. I'd like to see Essential Service was built on the premises of science, and yet we never use science to improve this particular field, and it needs to be done. That's my position on it.
Yeah, I agree. I mean, I wonder too, going back to drawing from your, past experience, and then obviously seeing further opportunity for improvement going forward, and bringing in that science component. I think it's a very good point. And I wonder, what would our next steps really be for the industry? Obviously, like we've seen with Pennsylvania, that's a huge win. But again, 5th state in 20 years, we got a long way to go, right? So what would be our most effective next steps is what I'm wondering.
I don't know. There are a number of states that have been working on it for years. I know Virginia was working on it. I know Michigan was working on it. I heard some of the states out west were working on it. I haven't really kept up on the progress they have made. Probably Ishan would have more information in that regard. I would focus in right now on bringing essential service managers together and pulling resources from their community, both techs, academia, and industry, into developing programs that work, and building infrastructure within their states so that when they go to their legislature, when they go to their health departments, they have a sound plan to institute it. I mean, now with COVID-19, I think all the politicians are very receptive to anything that's infection control related. So I believe that the opportunity is upon us. It's just that you have to motivate people and get them organized and working together to that end. That's what I would recommend.
That's a great point, Tony, that you brought up about it being in the height of a pandemic. We think of that as obviously a huge negative. But that may be a prime time also to raise our concerns and, take the opportunity to elevate the profession further. What a great point. I know for a lot of our listeners, there's people who are involved with ISHM or CBSPD. I know I can speak to ISHM, and something that I receive as a member of ISHM is they give us these emails that are already crafted, and they help us to shine a light on the profession and send it to all of our representatives and our state public servants. All we have to do is basically download it and send it off, and it's pretty easy to do. And I actually did that this year, and I got responses from most everybody. It took some of them a little while, but the senators and representatives, they all really appreciated it, and it's just one simple thing that we can do.
You have to build relationships with them.
Yes, that's right.
It's not only sending a letter, it's actually going there. When New York State passed it, they sent busloads of central directors and technicians up to Albany to sit and meet with the legislature. It was a very powerful experience. And, they put the managers with several techs, and they would send them out to different legislatures. And they sent me with one group of techs. As I was going into the meeting, I was saying to myself, oh my goodness, I'm going to have to really carry this meeting. I didn't have to say a word. The techs did an excellent job. They were wonderful. They knew all the talking points. They were very impressive. So you need to bring everybody together and go to your legislatures, develop relationships, let them understand the reasons why you're asking them for this. It's a lot of work, but it's worth it in the end.
Wow, Tony, that's a really good point. And one that I've used in many of my talks. We present for HealthMark a lot, education programs, and I always try to implore folks to build relationships and work at things much, much harder. And that was a really good point. And, thinking about it and how that works for us in our circumstance, trying to start that relationship and that dialogue with our own state representation, that letter was a great way to plant seeds, but I've got a lot of work to do still, that's a really good point that you brought up. And I'm like, oh, why didn't I think of that right away, and just start typing away as soon as I got their emails back. I thought, wow, that was a great win for us. But that was really the beginning, right? That was just the beginning.
That is the beginning. Let me tell you something. The legislature is really good in responding to letters.
Constituents.
Where you want to get them is face to face. Sit down with them. Let them see you and understand your passion for this. It makes a big difference.
I wonder if they do Zoom calls. Oh my gosh,
point. I don't know.
Yeah, that was a fantastic point. I think that gives us something for our listeners to go on. I really think, drawing from your experience, some of that, how do we make this happen? How do we go about doing it? It's really, we got to rise up and actually go and physically do this and build relationships with these people and really move the needle forward.
You might want to start with your state health department. Start with your state health department. Not many state health departments really have surveillance programs for acute or ambulatory care. They basically respond to complaints. But there's somebody there in charge, and they could be a cheerleader and give you personnel in the legislature that would be responsive to this approach. So they're a good resource to start. and then hit the legislature. And one thing that you have to understand with the legislature, nothing happens immediately. It takes a long, long time to get anything through. And then sometimes they mess it up anyway.
Yeah, I think we can all agree on that one. Yeah. But hey, anything to elevate the profession.
But Kevin, you don't even need the legislation. You need strong managers that believe in certification and start the program and sell it to administration and do it on your own.
Yeah.
Get the program started.
Yeah. Why wait, right? Yeah.
Yeah.
Develop your people, hire them in, maybe they're assistants like we talked about earlier, but maybe they're hired on with that
Career
understanding that, within a year or whatever, if you're going to stay on, you're going to be at least studying and moving towards that certification credential. And then at that point, you can even take a step up in the ladder. You might get a title change, you might get a wage increase, those types of things. And those are things that I think people are doing, but again, it's it's definitely with a mixed bag across the entire industry, how people are doing it, how they're implementing it, to what success are they having with it, which is why I think people bank on the legislature thing. But I think, to your point, it's always important to have that going on. But at some point, we as leaders in our health systems and hospitals, we have to set the expectations ourselves as well. So that's a good point, and obviously that happens generally much quicker than law. So
that's true.
At least that's the hope, right?
It wouldn't be a bad idea also to really focus in, whether it be ISHN or whoever, to build a strong management program. Probably with the onset of virtual education, something can be built out nationwide for this industry. And it needs to be done. It really does. That means a lot of people working together to get it done from all over the country.
Yeah, Tony, that's a great point. And for any of our listeners out there with a little bit of entrepreneurial spirit, that's an opportunity right there. I mean, and this is the time to build a virtual program, partner with a college, do whatever needs to be done. But I think you're on the right track with that, especially with a management program. I love that idea. That's fantastic. Yes. So, Tony, I just want to thank you. We are running out of time, but I want to thank you so much for coming on the show. I think obviously having somebody who's been so involved in elevating the industry come on is just such a privilege. And I just want to thank you for coming and also sharing your experience and some of your thoughts about how we should attack this thing going forward and really work at elevating the profession.
Thank you for having me. And I really enjoyed working with the central supply industry. I believe that they're unsung heroes within the healthcare system. They're unappreciated. And I do believe what I've seen in New Jersey is that certification has increased their self-awareness and esteem. They really feel like they achieved something by going through certification, which I think is very important. So good luck to you and good luck to the industry, and have a great holidays.
Thank you, Tony. You as well. Really appreciate it. That wraps up our show with Tony Monaco. It was really great to get his thoughts on the progression of certification and education in the sterile processing world. If I had to sum it all up, Tony and I agree there is still a lot of work to be done regarding education and certification. But one thing we can do is to prioritize certification in our own facility. This is going to be the quickest and easiest way to get started. 2 is to get involved with your legislators and establish a relationship with them in order to promote the profession. And lastly, we should focus on educating our department leaders and develop programs specifically for them. Please remember to subscribe to our podcast and let us know your thoughts or questions by sending them to our email address at asktheeducator@hmark.com. Thank you all for listening. All opinions expressed on this show are those of the presenters. Before using any medical device, it is important to review the device manufacturer's instructions for use.